you've had to fight your insurance while fighting cancer.
That's right.
You were pre-approved, and at 11 o'clock at night, the doctor calls and says, no, it's not approved.
They put a price tag on my husband's life and decided that he was not worth it.
Do you feel like if things had gone differently, he could still be here?
Oh, 100%.
I got to look behind the curtain.
He says the system is rigged. In December 2024, Luigi Manion, a 26-year-old Ivy League graduate, allegedly pulled out a gun and murdered United Healthcare CEO Brian Thompson in cold blood on a busy street in New York City. Manion's alleged crime sparked a storm of anger among Americans, but many were not pointing fingers at the alleged gunman. Instead, one poll indicated that 1 in 4 people sympathized with Manion, highlighting deep anger and frustration with U.S. healthcare, a system that includes high cost, denials of care, and the perceived exploitation of patients. Angela says she knows all too well the anger and frustration people feel about health insurance companies. Just 1 year after the death of her husband from stage 4 stomach cancer, Angela says she blames his insurance company for putting profit over people and contributing to killing him. Angela, thank you for joining me tonight.
Yeah, hi.
Let me first say I'm very sorry for your loss. It's been just over a year now, right?
Yeah, thank you.
And you'd been married 22 years and you have 3 children, 19, 16, and 15?
Yeah.
So tell me how you're all doing.
We're working through our grief, trying to process everything, trying to figure out life without him. He was a good dad. He was a good husband. He was there. He was a really good man, and he was a really hard worker. He provided for this family. He made his kids and myself number one. We're still in shock. We're still trying to figure out every day, like, how to process, how to live life without him. What is this new normal?
Do you feel like he doesn't have to be gone right now, that if things had gone differently, he could still be here?
Oh, 100%.
We're in America. I mean, this is supposedly the most sophisticated country on the planet in terms of healthcare, and you guys had insurance. You blame him being gone at least partially on the treatment that you got, the mistreatment you got from the insurance company. Are you frustrated? Are you angry? How would you describe your emotions with regard to how you feel you were treated by the insurance company?
In the beginning, it was complete disbelief. It was shock. I didn't think anything like this would happen to me or to our family. He was getting better. We were sent to Houston to do the next step of care that he needed. We're from Louisville, Kentucky, and his treatment was pre-approved. It was a surgery. We brought our 3 kids down there, and the night before the surgery, the surgeon called us about 11 o'clock at night and told us that it was denied. We stayed in Houston for 4 weeks fighting it. It was never approved. Ultimately, it was a doctor of gynecology that denied it completely. My husband was a male, born a male at birth, always had been a male, and he had stomach cancer. When we returned home, he immediately got sick again. The cancer had spread, and he died January 27th of 2024.
Wow. So you got all the way to Houston to go to MD Anderson. You were pre-approved, and at 11 o'clock at night, the doctor calls and says, no, it's not approved, and you were going in for hyperthermic intraperitoneal surgery, which they said was experimental. In fact, this isn't a way out there procedure at all. This is something MD Anderson does on a fairly routine basis, from what I understand. Is that correct?
Yes, it is correct.
And you stayed there, you appealed this and stayed there 4 weeks. Were you getting treatment during those 4 weeks?
No, unfortunately, the surgery that he needed to have, he was required to be off chemotherapy for like 3 or 4 weeks. And so he had to actually be off chemo in order to get the treatment.
So this was pre-approved, so they stopped one treatment regimen to prepare you for another treatment regimen, then pull that treatment regimen out from under you, and you spend 4 more weeks trying to get that. So this is now 8 weeks without treatment, which allows the disease to progress while you're going through this bureaucratic fight. And the doctor that pulled the approval and denied this was not an oncologist?
No. The doctor that ended up reviewing this from the insurance company was an OBGYN.
Okay, so your doctor at MD Anderson felt like this would be reversed quickly and would get approved.
Yeah.
And that was a good faith belief on the doctor's part. They thought, hey, they won't do this. They'll let this go forward.
Yeah. He said that it was pretty common to get an initial denial. But he said, hold tight, max maybe a week.
And you say that your husband got sick because of not being on the chemo, and the surgeon said, finally, hey, go home and enjoy the rest of the time you have with the family, insinuating it's over. There's not much you can do now.
Yeah.
Take me through that moment. What did the two of you say when you sat down and talked about that? When you got that message, what was that like?
We said that we weren't going to go home. We said that we weren't going to have a price tag put on his life, and we decided that we would try to raise funds ourselves. And I took my guitar and wrote some goofy song and stood in front of MD Anderson Hospital and created signs for my husband to hold. And we created a video in front of MD Anderson Hospital and put it on all the social media things and everything else. It went viral, and we put a GoFundMe out there to try to raise the funds. But unfortunately, he got sick. So he got sick again. So at any rate, we had to come home. Within 2 days of being home, he was hospitalized for 2 weeks. The cancer had spread. We had to start the chemo back up immediately. He was no longer a candidate for the surgery that we had went to Houston to have. So yeah, that's where it put us where we are now.
And what do you say about the insurance company? What's your bottom line on that?
They put a price tag on my husband's life and decided that he was not worth it.
How do your children feel about it?
They don't actually like to talk about it. They don't like to think about that it could be possibly the insurance's fault that their dad died. It's just, it's too much. My youngest was 13 when he was diagnosed. They're in shock. In some ways, these kids have had to mature 10 years beyond their age and deal with things they never should have had to deal with. And in other ways, they've regressed 5 years.
Wow. Well, we're going to dig into this throughout the entire show. So stay with us here as we try to figure out, really how bad this is getting across this country. I can tell you the insurance industry at large is making a lot of money, billions and billions of dollars so far this year, just in the first quarter. So stay with us. Coming up, Kay was diagnosed with breast cancer at 35 years old. She says her insurance company denied her potentially life-saving medication. We're going to find out what she had to do just to survive. You've heard me say it before. Real change starts with real understanding, and that's why I've had Dr. Daniel Amen on my show many times over the years. At Amen Clinics, they do something different. They look at your brain. With nearly 300,000 brain scans from patients in over 155 countries, they take the guesswork out of mental health care. Anxiety, depression, trauma, memory issues. If you're struggling, it's time for answers. Call 866-580-6569 or go to amenclinics.com/Dr. Phil and take the first step. Call 866-580-6569 or go to amenclinics.com/Dr. Phil. When Kay was just 35 years old, she learned she had breast cancer. Kay says that while she was ready to fight, she never imagined she would be battling with health insurance companies for 10 years. Now, Kay, thank you for being here. You've had to fight your insurance while fighting cancer. So you've had to do a two-front battle here. What was your lowest point in this whole thing?
I think there is no lowest point because, quite frankly, the battle keeps on going on. And I think every time I submit a claim, I feel really uncomfortable because I'm not sure if it's going to be paid. Every time I have a new medical procedure, I'm never sure if it's going to be, denied. And so I'm constantly under the threat, really, of not knowing whether or not my medical care is going to be covered.
You had a claim with United Healthcare for cancer medication, right? And it was $6,200. Was this turned down?
It was. It was turned down for about 8 months until we resolved it. But that was, again, $6,200 every month that I had to take out of my savings in order to front it. I would completely, I guess panicked would be the word. I was absolutely panicked that I didn't have enough money, and yet I could not take the risk that should they deny me, that I wouldn't be paid back, but I also would be without care. So it was just a risk that I had to take for me and my family.
But there was no question about your diagnosis, correct?
No, I'm stage 4 metastatic breast cancer. It's considered a terminal disease. So absolutely no question in anybody's mind.
All right. And there was no question that you were seeing a licensed, registered physician?
Absolutely none.
And there was no question that that's what your physician prescribed?
No question. In fact, it's a team of providers and oncologists that work with me in order to keep me alive, basically.
Okay, so there's no doubt that this was your diagnosis, no doubt that this was a legitimate registered physician, no doubt that this is the prescription that was given by the physician. So you had the disease diagnosed by a physician who prescribed the medication, and the insurance company said no.
Yeah.
Did they have an alternative plan in mind? What did they suggest instead?
Well, the first answer they gave me was that it was not medically necessary. And the other plan was to talk about different alternatives. Why I find that probably troubling is I didn't know that that was an insurance company's job, is to educate and make medical recommendations. They don't know me. I don't know them. They don't have my medical records. And so I found this particularly troubling that they would want me to pursue alternative treatments when they aren't my provider at all. So that's...
The person that was saying, do some alternative treatment, they didn't see you. This wasn't an insurance company physician.
No, this was an insurance company physician denying me, but
they didn't see
no.
you.
No.
They didn't examine you. They didn't look at your lab reports or draw blood or look at your scans or anything of the sort. They just said, from where we sit, we just think you should do something cheaper.
Yep. I don't know if it's cheaper, but that's my guess. They just said it's not medically necessary.
Okay. Now, you paid $50,000 out of pocket for the treatment, correct?
That's right.
And if you hadn't had the $50,000, which I'm sure put a huge burden on you financially, I don't know very many people sitting around with $50,000 to spare. You were fortunate enough that you had that socked away somewhere, somehow. Then you needed a PET scan, right?
Yeah, this is again a year later with my current insurance.
Okay. And Angela's listening to this. I mean, you were listening to her story with her husband needing something as well. They approved it and then yanked it out from under him, but at least they waited till 11 o'clock at night when they had gone all the way to another state to get it done. So now you have another insurance company, you need a PET scan, and that's not exactly experimental. That was denied?
Yep, that was denied in October of last year.
Okay, now listen, I've spent a lot of time in the healthcare delivery system. A PET scan, this is a standard of care in monitoring disease progression. So you weren't getting these every other day, right? This was just in the ordinary monitoring of your disease. Why was it denied?
Again, the answer they gave me was that it was not medically necessary. But as you just mentioned, it's absolutely necessary, especially someone with stage 4 metastatic breast cancer. This is part of the treatment plan, is to make sure that the circulating tumor cells are not spreading. So I do this about every 5 months or so, just again, make sure that the treatments are working and the cancer is not out of control.
Right, because they want to see if it's metastasized and gone to some other organ or gotten into your lymph nodes or whatever. So that was denied. Okay.
It was denied.
Tell me where you stand now today.
I have appealed that denial twice. I think my own oncologist was shocked that the medical director held his denial for a PET scan. She fought for just a chest CT and an MRI as an alternative. They declined that as well. So I had to go back to my employer and ask them to advocate for me. In the meantime, I had appealed at the state level to the Attorney General. I went to the Municipal Health Board. I filed an ethics complaint against Evacor and Cigna. I've reached out to not-for-profits like Cancer Care to get advocacy. And finally, I had it pushed through. And once I got my scan, I found out that I had a metastasis to my liver.
I'm so sorry to hear that. How long was it delayed?
It was delayed about 2 months.
And how are you doing today?
I'm doing okay. I'm still working through it, still working through the metastasis and the new treatment plan. I'm glad I caught it, in time so that I can control it because, as you know, the liver is everything when you're processing a lot of cancer medication.
Of course it is. Absolutely it is. Okay. Stay with us. A former pharma representative turned watchdog who says the healthcare system isn't just broken, it's actually rigged. You two are going to be really interested in hearing what he has to say next. This message is sponsored by Greenlight. Remember summertime as a kid? The freedom, the boredom, the first taste of independence? Like setting up a lemonade stand or earning your first dollar. Summer's the perfect time to teach kids real-world money skills that they'll use for life. Greenlight is a debit card and money app for families. Parents can send money, manage chores, and track spending. Kids learn to save, invest, and spend wisely, all in a fun, game-like experience. My producer, LaFern, and her son, David, use it and love it. I wish I had Greenlight when my kids got their first allowance. It would have made life so much easier. Greenlight is the easy way to raise financially smart kids. Don't wait to teach your kids real-world money skills. Start your risk-free trial today at greenlight.com/Phil. That's greenlight.com/Phil. greenlight.com/Phil. Brigham Buhler is a former Big Pharma rep turned healthcare watchdog who says that health insurance companies incentivize delaying, denying, and kicking the can down the road. He says the system is rigged and it's not in the patient's favor. Brigham, thanks for being here.
Thank you for having me on.
Well, tell me, how is the system rigged? I don't disagree with you. I just want to be enlightened further.
We spend more money on healthcare than any other nation. And yet we have 1.7 million people dying a year of chronic disease. more than every war we've ever fought as a nation. And it's because the big insurance companies aren't just implicitly involved in delaying and denying coverage. They are implicitly involved in monetizing chronic disease. The insurance companies, the big five insurance companies made $1.2 trillion last year in revenue, trillion, double that of the big pharmaceutical industry. And they do it by delaying the coverage that so many Americans have fought so hard for and spend their hard-earned dollars for every day. Like the two folks that you're interviewing today, their story, unfortunately, isn't the exception to the rule. It's the rule. Delay, deny, depose. What Luigi wrote on those bullets, it's a travesty what's happening in our country.
Well, wouldn't they make more money if they got early intervention, got this stuff under control, and paid out fewer benefits because they got the situation handled?
You show me the money and I'll show you the outcomes, right? Show me the incentive system, I'll show you the outcomes. I thought the same thing until I got to look behind the curtain. But the truth of the matter is the average American is covered with insurance through their employer, and they switch jobs every 2.5 years. And these insurance companies have the analytics. We know that we could stop somebody from going from pre-diabetes to diabetes, and we could save 7x on the annual cost of healthcare in our system. But they know if they allow this patient to just transition to diabetes, by the time the diabetes manifests, it's another insurance company's problem, or even worse, Medicare, Medicaid's problem, us, the taxpayer. And so they are incentivized to delay and deny care, kick the can down the road, and hope that you go off and become somebody else's problem. And another tragedy of all this is, less than 2% of people challenge the denial. 1 in 500 people challenge the denial. So now the offense for the insurance companies has become deny first, ask questions later.
So this is a war of attrition. Their attitude is, okay, look, if I can just delay this, if I can push this off long enough, they'll just go away. They'll change jobs. They'll go from my insurance company to somebody else's insurance company. And when this finally lands and the big money has to be paid, it'll be somebody else's problem, not mine. And I, as a manager, have to make my numbers this quarter. I have to make my numbers this year. So I don't care if it's going to wind up costing more money later. I got to make my money right now. So I'm looking at the short term. I don't care what it costs long term. I'm selling out, but as long as I make my bonus this quarter, who cares?
Bingo. And it's even darker than that. What a lot of people don't understand, and Trump and Bobby Kennedy and these folks have been trying to blow the whistle on this. I've talked about it on Rogan. It goes deeper than that, Dr. Phil. The insurance companies, the big five insurance companies, went out in the 90s and acquired the pharmacy benefit managers. These were middlemen brought into the marketplace to attempt to drive down the cost of prescription drug care and make it affordable for the average American. Be an ally and an advocate for us, the American people. What did they do? They instead began to profiteer off of chronic disease. The average American's on 4 or more prescription drugs. 4. Why? Because the insurance companies are literally making profit off of you being on medication. They are now incentivized for us to be chronically ill. It is not as simple as delaying and denying coverage, obstructing your ability to get care. It is deeper than even that, to where there's profit being made off of prescription medications. And these pharmacy benefit managers are nothing more than profit centers for the big five insurance companies, which controls over 87% of the prescription drug care in America. And the only reason I know that is from owning pharmacies and seeing behind the scenes and the way they will deny or move your grandma or grandpa or loved one to a different medication, not because it's the best medication for the patient, but because it's the best medication for their pocketbook.
Well, Angela was caught up in a situation where it got to the point that it was time to pony up for an expensive procedure, a sophisticated procedure, but expensive, but a highly likely positive outcome for this procedure. And that's where they drew the line in the sand and said, no, not going further. Do you think that is an actuarial decision where they say, okay, this one, now this doesn't make financial sense, and they put profit above the patient at that point? Did Angela's husband get balance sheet out of life?
I think he did. I hate to say that, Angela. I really have seen the dark side of what happens when we put profits over people. And I've seen it time and time again. And I lost my brother to the opioid crisis. And that was perpetuated again. A large chunk of those profits made by the opioids were made by the insurance companies themselves through these holding companies and middlemen. And if they can delay and deny coverage and hit their quarterly earnings, it's unfortunate, but we've built an incentive system that incentivizes profitability, not patient care. And those goals aren't aligned with us, the people that work so hard and pay all of our hard-earned dollars with the hope that when we need that insurance, it will be there for us.
It's just absolutely outrageous. Now, look, Brigham also blames corporate capture for the problems with health insurance companies. We're going to talk about what that means after the break.
There's a series of industries that actually make money by keeping us sick. It's not just industries, but it's the med schools, the hospitals. The insurance companies you would think would want us healthy, but they actually make more money if we get sicker. And then, of course, the pharmaceutical companies, if you have a chronic disease, you're a lifetime patient.
Brigham says that corporatization of healthcare allows corporations, most of them investment companies, to exert way too much influence on healthcare, health insurance, and the decisions made because they are in the business of making money, not saving lives. And if Kay hadn't had a savings account to cover $50,000 worth of medication, she probably wouldn't be sitting here right now. Angela's husband, Tracy, is not here right now for just that reason. And, you know, Brigham, this is corporate capture. And explain what you mean by that. I work with Bobby Kennedy all the time, and I know, but I want you to explain it so Kay and Angela and everybody at home understands what we're talking about.
It's front to back throughout our entire healthcare system, right? And if we are incentivized and profiteering off of chronic disease, and there's so much money being made off prescription drug care, and it is a large chunk of the revenue stream of these insurance companies because they were allowed to go out and corporately capture these pharmacy benefit managers, these middlemen that were originally put in place. And so these entities, the pharmacy benefit manager, were put in place in the 80s to drive down the cost of prescription drug care, to be an ally and an advocate for us, the American people. Once they were captured by the insurance companies, rather than driving down the cost of prescription drug care, they begin to collude with Big Pharma to drive up the cost of prescription drug care. And don't take my word for it. Look at the Senate and its investigations into these things. They found that roughly 30% of the cost of insulin increase in the United States was because the pharmacy benefit managers, which are nothing more than your insurance companies, were monetizing your chronic disease. You know, out of the last 11 heads of the FDA, 10 have gone to work for industry. These are checks and balances put in place to protect the American people. And throughout the process, these institutions have been captured all the way to the hospital systems. Many of the hospital systems and pharmacies themselves and primary cares themselves have been gobbled up and captured by these insurance companies and by big industry. And so if I'm a primary care in America, I can't make a living anymore. And you can't get to the root cause of chronic disease because you have 6 minutes on average with a patient to uncover the root cause. And you can't do anything in that time, not to mention you can't do a deep dive. And both of these, both of the folks we're talking to today, you know, are battling cancer and have fought the battle with cancer. There are tests out there that allow us to screen for cancer 7 years in advance and test it at stage 0 with stunning accuracy. But those tests aren't available in the marketplace in America, not because they don't work, but because the insurance companies don't want to pay for them.
There's no money in prevention, is what we're saying. And this has been known for a long time. And I spent a lot of my career in behavioral medicine, and we know that stress, for example, is a trigger for a lot of diseases, both bringing them on and exacerbating the diseases. If you can teach people to manage stress, you can lower the incidence and the progression of disease. But do companies and insurance companies pay for that, pay for stress management, pay for stress training? No, they don't, because there's no money in it. There's no way for them to monetize that. And so disease prevention just doesn't make sense because it doesn't make money. And what you're saying here is they make money. The more we have sick people and the longer they are sick, the more money is being made by the medical monster. I mean, whether they're making it on insurance, whether they're making on treatment, whether they're making it on pharmaceutical agents, the longer. More people are sick, the more money they're making. That's basically what you're saying.
No, you're spot on. And I know Bobby's attacking our food system and the broken, corrupt food system. And as we peel the layers of this onion back, who owns that food system, right? A lot of the food was captured in the 80s by Big Tobacco, and Big Tobacco began to take its same old offense that it ran in the tobacco industry and move it to the food industry. And we pivoted to ultra-processed foods that are low in nutrients, but high in profits, I testified in front of the Texas Senate this past week and explained to them an ultra-processed food from one of these manufacturers has a 50% profit margin versus healthy food like eggs or any of these more nutrient-dense foods have about a 10 to 15% profit margin. But it also perpetuates and fuels the chronic disease crisis, which is then monetized by the same folks that own all these companies.
Yeah, and it all just comes down to the old saying that we started with back in the Watergate days: follow the money. One doctor says he left his practice because he and his patients were being scammed by health insurance companies. We're going to hear what he has to say next. Dr. Bill Hennessy worked as a board-certified physical medicine and rehabilitation physician for 25 years. Now, Bill, you got out of that. You didn't like all of the tactics that health insurance companies use to avoid giving care to patients. You just got tired of messing with it, true?
It's very true. Forward definition of an insurance company: collect premium, deny payment.
Yeah. And the tactics that these insurance companies use, we've been talking about them, but they use to delay and deny claims is one, requiring prior authorization. They may deny if it's not medically necessary, confusing the policyholder with fine print, requesting unnecessary or excessive information, repeatedly assigning new claims adjusters, and then finding some little error that was not right, and so you got to start all over again. It's like putting them in a maze where there's just no way out. You had to deal with it as a caregiver, provider. Patients had to deal with it as patients. It can be overwhelming sometimes. I mean, Kay and Angela have both faced it and dealt with it. You've come up with a way to help patients navigate this. Tell us about that.
Yeah, so if we look at what the industry is doing on purpose, they want all of us as patients to be frustrated and confused. Those are the two words. They want, therefore, us to be left feeling hopeless and helpless. Therefore, we open up our wallets and they don't have to pay. So when the average family of four is paying $2,500 a month for health insurance, plus a $6,000 per person deductible, the insurance companies, that isn't just revenue, that's 100% profit just about all the time. And so I've owned a physician billing company. I've founded a price transparency company, and then an advocacy company so we can do it all. And over time, I've figured out how to get people the care they deserve, either through insurance or, in Kay's case, we don't know what the real price of care should have been. She paid $50,000. Maybe it was only worth $22,000, for example. So my company, CareGuide, is putting the care back into healthcare, where we are helping people know where to go and what to pay ahead of time, or we're resolving high-cost hospital bills afterward, and we do help with these insurance denials.
You say that federal law requires insurance companies to publish pricing information. Pricing for what? What do they have to disclose?
Both health insurance companies, commonly known as Blue Shield, United, Cigna, and Aetna, as well as 5,700 hospitals in this country, are supposed to publish pricing. They don't, except for cheap stuff. The more expensive the care, for example, cardiology or oncology, they deep six it. And that's on purpose. They don't want the public to see it. They want to have their competition see it. And no one's putting them in check. But it is under the direction of Health and Human Services, HHS, where if laws were enforced on the book for price transparency mandates, we would get to a point where we can separate care from insurance and have pricing known. But as long as they're getting away without any fines or jail time, trust me, the illegal return on investment's higher for the insurance companies and hospitals. They're going to keep going to get away with it.
Okay, we got to take a quick break, but I got an important question for you when we come back. Bill says that denials can be overturned by submitting a different diagnosis or billing code, which highlights the complexity of the system. And then I've got a question that I think is really interesting. At least I think it's interesting when we come back. Well, we're back, and I have a question for Dr. Hennessy, and it goes along the lines of what you're saying, because I've been in the healthcare delivery system, and you're exactly right. Sometimes I could change a diagnosis, which either one could apply. One would allow for a whole lot more coverage than another, and both of them aptly fit, and you just have to see which peg goes in which hole. But I've seen with hospitals that somebody would get a hospital bill, and it might be $110,000, and they can go into the administrator or the billing people and say, well, look, I don't have insurance. And the bill would be $110,000 if they had insurance and $17,000 if they don't have insurance. Now, how do they get away with charging 8 or 10x if you have insurance and a more reasonable price if you don't?
Right, so you're punished for having insurance. Great statement, Dr. Phil. So I want you to think of the hospital as a castle. It has a moat around it. And there are 4 alligators in that moat. And their names are Blue Shield, United, Cigna, and Aetna. You have to do business with them to get to the castle. So they collude to make profit. The stock shareholders of the 4 publicly traded insurance companies need the price of care to go up because under the Affordable Care Act, you're allowed to keep 20% for admin and profit. 80% must be spent on clinical. So it becomes painfully obvious that it's better to have 20% of $200 billion instead of 20% of $100 billion. So there's plenty of collusion to say, aha, this person has insurance. Let's play the billing coding game and make sure we get to both make more money.
Yeah. And if I don't have insurance, then look, here, just give me this and get out of the way because I got much bigger fish to fry.
That's true. But listen, I want everybody watching to understand under the Affordable Care Act, there is one silver lining. It's called IRS 501R. Nonprofit hospitals have to give back free and discounted care. That's to people making more money than Medicaid, but not enough for an overpriced publicly traded carrier plan. So 100 million people, in my estimation, qualify for free or discounted care. So always speak to the financial counselor of the hospital. So for example, family of 3 making $53,000 or less, it's free care.
Wow. Unbelievable. We'll be right back. We reached out to Angela and Kay's insurance companies for comments, and Angela's health insurance, Blue Cross Blue Shield of Illinois, did not respond to our producers, but made this public statement in regard to her husband's case. Quote, "We are committed to increasing access to safe, appropriate, and effective health care based on the best available information and research." End quote. Kay's health insurance company, Cigna, made the following statement. "When patients face illness, they look to us to help them during a difficult and vulnerable time. We strive to do our best to ensure that each person gets the appropriate care as quickly and easily as possible. We fell short for Miss Sue. We have discussed this with her and apologized for how we handled her care. We take our responsibility to patients seriously, and we always work to improve how we support them." End quote. Well, there you have it. We're unfortunately out of time, and I want to thank Angela, Kay, Brigham, and Dr. Hennessy for joining us. And Dr. Hennessy has some tools you can use, and with his permission, I'm going to put links to all of that on our website here at drphil.com, so you can go there and click on the link and get to his site, which can help you navigate. I suspect save you a lot of money and a lot of heartache. We will have even more information about tonight's show, as I say, on our website, so make sure to log on to drphil.com. All of you guys, thank you for sharing your stories. I think it will touch a lot of people's lives. I wish you nothing but the best. Good night and goodbye. Thank you.